Are you struggling with arthritis and wondering what foods might be making your symptoms worse? Tune in to our latest YouTube video where we reveal the top 10 foods you should avoid if you have arthritis. We'll explain how certain items can increase inflammation and pain, potentially aggravating your condition. From everyday snacks to common ingredients, we uncover the foods that might be contributing to your discomfort. Some of these foods might surprise you. Arthritis, a condition characterized by joint pain and inflammation, affects millions of people worldwide. While medication and therapy are primary treatments, dietary choices play a crucial role in managing arthritis symptoms. Certain foods can aggravate inflammation, leading to increased pain and stiffness. This video delves into the foods that individuals with arthritis should consider avoiding to help manage their symptoms more effectively. The consumption of red and processed meats, common in many diets, is a concern for those with arthritis due to their high saturated fat content and compounds that may worsen symptoms. Red meats and processed meats like sausages and bacon increase the body's production of inflammatory chemicals, exacerbating joint pain and swelling. These meats also contain advanced glycation end products, which promote oxidative stress and inflammation, especially when cooked at high temperatures. Additionally, there's a link between these meats and an increased risk of heart disease, a concern for arthritis patients, particularly those with rheumatoid arthritis. Substituting with leaner proteins like poultry, fish, beans, and legumes, especially omega-3 rich fish like salmon, can be beneficial for both joint and heart health. Moderation in consuming red and processed meats is key. Choosing leaner cuts and healthier cooking methods can reduce the intake of harmful fats and advanced glycation end products. Also, a diet rich in fiber, fruits, vegetables, and whole grains supports gut health, which is important for managing arthritis. Before we continue, please consider subscribing and don't forget to hit the thumbs up button. Refined sugars and high-fructose corn syrup are prevalent in many processed foods and beverages, posing health risks, especially for those with arthritis. Consuming these sweeteners can trigger inflammatory responses, exacerbating joint pain and swelling in arthritis sufferers. Commonly found in soft drinks, candies, baked goods, and some condiments, these sugars are hard to avoid, making it crucial to scrutinize food labels. Additionally, excessive intake of these sugars can weaken the immune system, potentially worsening chronic conditions like arthritis. Fried and processed foods prevalent in many diets can adversely affect health, particularly for those with arthritis. These foods are high in unhealthy fats, such as trans fats and saturated fats, which trigger inflammation, exacerbating arthritis symptoms like joint pain and swelling. Fried foods also contain advanced glycation end products, AGEs, which form at high cooking temperatures and contribute to oxidative stress and inflammation. Regular consumption of these foods can lead to weight gain, putting extra stress on joints and potentially accelerating arthritis-related damage. Moreover, processed foods often lack dietary fiber, negatively impacting gut health and potentially increasing systemic inflammation. Gluten and refined grains play a significant role in the diets of individuals with arthritis, particularly concerning inflammation and joint health. Gluten, found in wheat, barley, and rye, can cause inflammation, especially in those with celiac disease or non-celiac gluten sensitivity, exacerbating arthritis symptoms like joint pain and stiffness. Celiac disease sufferers experience an autoimmune response to gluten that can worsen autoimmune arthritis symptoms. Similarly, non-celiac gluten sensitivity can cause arthritis-like symptoms, which may improve with a gluten-free diet. Refined grains, which lack fiber and nutrients, can increase blood sugar levels and inflammatory markers, potentially aggravating arthritis. Conversely, whole grains like brown rice, quinoa, and oats are beneficial as they have a lower glycemic index and help manage inflammation. For those reducing or eliminating gluten, careful label reading is essential, as gluten is prevalent in many foods. Dairy products, while common in diets, can affect individuals with arthritis differently. Some people may find that dairy exacerbates arthritis symptoms due to proteins like casein and whey, which can trigger an inflammatory response. However, this sensitivity varies, and not everyone with arthritis will have a negative reaction to dairy. Since dairy is a key source of calcium and vitamin D, essential for bone health, those avoiding dairy should seek alternative sources like leafy greens, fortified plant milks, or supplements. For those with lactose intolerance, plant-based dairy alternatives such as almond, soy, oat, and rice milks are viable options. Recent research indicates that the type of casein, specifically A1 and A2, may affect inflammation. Some individuals who are sensitive to A1 casein might better tolerate A2 milk, found in certain breeds of cows, goats, sheep, and buffalo. Fermented dairy products like yogurt and kefir, rich in probiotics, can also be more tolerable and beneficial for gut health. For arthritis sufferers, monitoring dairy intake and observing the body's response can be helpful. Keeping a food diary can assist in identifying any links between dairy consumption and arthritis symptoms, allowing for more tailored dietary choices. Artificial additives and preservatives found in many processed foods can significantly impact individuals with arthritis. It's important to understand their effects and manage their intake to help alleviate arthritis symptoms. Certain additives like monosodium glutamate, MSG, and aspartame can trigger inflammatory responses in the body. MSG, a flavor enhancer in processed and fast foods, may increase inflammation, exacerbating arthritis pain and swelling. Aspartame, commonly found in diet sodas and sugar-free products, has also been linked to inflammation in some individuals. Preservatives such as sodium benzoate and potassium sorbate, used to extend the shelf life of food products, can contribute to inflammation and worsen arthritis symptoms in sensitive individuals. Additionally, emerging research suggests that these additives and preservatives can negatively impact gut health, which is crucial for regulating the immune system and inflammation. Disruption of gut bacteria by these substances may lead to increased systemic inflammation and potentially aggravate arthritis symptoms. Identifying these additives in foods can be challenging, as they are often hidden under various names in ingredient lists. Careful label reading is essential for those with arthritis to avoid these additives, especially in processed snacks, ready meals, fast food, and sugary beverages. Excessive salt intake is a significant dietary concern, especially for individuals with arthritis, as it can impact both arthritis symptoms and overall health. Salt, or sodium chloride, is vital for bodily functions, but in excess it can cause inflammation and fluid retention, exacerbating arthritis symptoms like swelling and stiffness. This increased fluid retention can put extra pressure on the joints, leading to discomfort. High salt consumption is also known to raise blood pressure, and for those with arthritis, particularly rheumatoid arthritis, there's an increased risk of cardiovascular diseases. Therefore, managing salt intake is crucial for both joint and heart health. Processed and pre-packaged foods, including canned soups, frozen dinners, snack foods, and fast food, are major sources of excessive salt. Even foods that don't taste particularly salty, such as bread and breakfast cereals, can contain high sodium levels. Certain vegetable oils, especially those high in omega-6 fatty acids like corn, soybean, sunflower, and safflower oils, can exacerbate inflammation when consumed in excess, which is particularly concerning for individuals with arthritis. The typical Western diet often has an imbalance of omega-6 and omega-3 fatty acids, leading to increased inflammation and worsening arthritis symptoms. Choosing oils with a better balance of omega-6 and omega-3 fatty acids, such as olive oil, flaxseed oil, and walnut oil, can be beneficial. Olive oil is notable for its anti-inflammatory properties, similar to NSAIDs. For high-temperature cooking, oils like avocado and canola oil are preferable due to their high smoke points and healthier fatty acid content. Alcohol consumption can notably affect individuals with arthritis. It can exacerbate the immune response in autoimmune conditions like rheumatoid arthritis, leading to increased inflammation and joint pain. As a diuretic, alcohol can cause dehydration, worsening joint pain and stiffness due to reduced joint lubrication. For those on arthritis medications, alcohol can interfere with drug effectiveness and increase the risk of adverse effects. In gout, a type of arthritis, alcohol, especially beer and spirits, can trigger flare-ups by raising uric acid levels in the blood. Excessive alcohol consumption also negatively impacts bone health, affecting calcium balance and hormone production, which are crucial for bone health. Some people with arthritis report increased pain and inflammation after consuming nightshade vegetables like tomatoes, potatoes, and eggplants. While there's limited scientific evidence to support this, it may be worth monitoring symptoms in relation to these foods. Managing arthritis involves a holistic approach, with diet playing a crucial role. Avoiding foods that trigger inflammation can significantly alleviate arthritis symptoms. It's important to remember that dietary needs can vary from person to person, so it's beneficial to consult with a healthcare provider or a dietitian for personalized advice.
Thank you for watching, and please click the like button and subscribe.